It's good to be with all you guys and to share some of our experience. I went from 0 to 90 with US Enzymes products in the last year and a half. I've been doing biological and energetic medicine for almost 35 years. And until I started using US Enzymes products, I was really at a loss for whose company's enzymes I would utilize. Some of the competitors, Biotics Research, Douglas Labs, this one, that one, none of them ever had either the impact or the tolerance. A lot of them are not tolerated well by your clients. So, you know, you don't want to be prescribing something for somebody that, even though it's well-intentioned, they come around and they've got belly burns, or they get, you know, it irritates them, or they can only take an HCl for a week or two and it starts to really bother them. So, you know, I just had a big gap in enzymatic therapies in my practice until Larry was able to introduce me to the US Enzymes and Master Supplements lines. And I do heart rate variability, and I do biometrics of body composition and bioimpedance. And so I can tell pretty rapidly whether somebody's going to tolerate something or not by our biometrics. And we have a pattern here because I see people from all over the place. They come in often from hours and hours away. So I wind up testing them, giving them a dosage of what their proposed protocol is going to be, and then re-examining them after that's gotten into their system. And I'm able to see the impact, and the reality is only one of three things happens. They get better, they get worse, or they stay the same. And so it's our experience that if somebody has an adverse reaction to something on the first day, you can expect it to happen repeatedly if you're going to repeat the dosages. And so conversely, if they have a really good reaction, then that's a therapeutic intervention that you want to take. Well, when I started EAV testing, electroacupuncture testing with the Master Supplements, quite by accident, Larry gave me samples because he knows I like to dose. This is what I was telling you about when we like to dose. He had little blue, they were probably like cream, you know, they look like a jar that we get hand cream or something in, small ones, I think.
That's going to be my favorite thing ever. It's like in the middle.
So when I disappear, I'll come back this time, okay? Anyway.
You need to like a smoke show when you disappear than when you come back.
So, you know, Larry gave me the US Enzymes Master Supplement in these vials. And then, like, this is Sun Balance, okay?
Is that the testing kit, Dr. Marrongelle?
It's a testing kit, yeah. So being who I am and how I test, I use electroacupuncture test tray, and I would just put them up 2 at a time and see if a person reacted positive or negative to it. Very, very much like somebody who's doing kinesiology, doing muscle testing, only I blind tested them. And I would see pretty rapidly a number of them people just absolutely don't want. And then when I would get a hit, it would be like, yeah, give me all of that you got. Okay. So it's very yes, no in my world of testing. And I just started to use them, and then I would dose them out of the test kit and refill them. But it was always a mystery, like, well, what did they want? Okay. Oh, they wanted HCl Zyme and TrueFlora or something. whatever it might have been. And I started to see the combinations for different cases come up repeatedly. And I got to see the transition from one thing to the other when somebody didn't want something, when they were done using a product. And that's kind of what I'd like to address a little bit today, about when is enough enough, and when do I move to the next thing? Because these aren't just Band-Aids that people are swallowing, okay? It's part of a metabolic process of changing the microbiome, and you have all the tools in your system to do that. It just depends where you come into the system to impact it, okay? I currently believe that what's going on in our food chain, in our environment, with electromagnetic stress, with microbial stress, and so forth and so on, I think what we're seeing is more an epidemiological phenomenon due to various environmental stressors than it is a microbial pandemic. Okay, so that's my own personal take on what's happening right now, because things are changing so rapidly with many of our clients, and we're seeing huge shifts in the microbiomes in people that we haven't seen before. So I really believe that in the presence of certain environmental chemicals and other food chain chemicals in the GI tract, plus poor digestion, plus poor microbiome, leads to dysfunction and disease, and frankly, a huge overgrowth of mold, yeast, and funguses as being a burden for a lot of people. One of the first things that we did notice impacted by the supplement line, by the master supplements and by the enzymes, was the influence on the vagus nerve and the relaxing component of heart rate variability. Okay, and since I've done probably well over 70,000 HRVs over the last 20 years, pre and post, and we've seen everything from world-class athletes to people who were on their way out. It is a prognosticator of physical fitness and risk of sudden cardiac death. And so anything that impacts the autonomic nervous system, which controls and coordinates 99.9% of all of our life functions, is a great impact for me and for my practice. And it's the basis for biological medicine. So when we started using the enzymes and the probiotics, normally you give somebody a probiotic, you're not going to see an immediate change in dysautonomia. Well, surprise, surprise, I did, and I do, okay, see it on a regular basis. That if someone needs, let's say, and I'll use myself for an example, because I just went through a little bit of a detox, and I rotate through my enzymes, but I rarely need to use probiotics because I use the Sun Balance fiber, the sun fiber, okay, on a pretty regular basis. And that's wonderful for establishing a good microbiome. And I use the Cleanzyme on an intermittent basis, usually 3 to 5 times a week. I'll do it every other day. I did a complete course of it, and now I just hit and run with that and move around with these things. But I tested myself the other day, and following an energetic intervention with PEMF, I'm like, it made me weak. Okay, it made me weak in 2 areas, and one of them was the small intestine. So I went and had my colleague test me, and sure enough, I needed Theralac Pro. So I just double dosed it. I just took 2 twice a day for 3 days. I don't have that computer here, but it took my biological age on digital pulse analysis from 52 down to 35. And Roland knows what I'm talking about. Huge impact on my biology just by changing up and putting in a really strong amount of small intestine microflora. And so, I not only prescribe this, I use it on a regular basis for myself and my family. And the impact to my practice has really been phenomenal. I'm not certain, but I think in Larry's area, I'm probably his number 2 account now. And his number 1 account has 3 or 4 doctors, and I'm a solo practice. So I use an awful lot of products.
I've seen your stock room. I can attest to putting stuff on the shelves.
What's that?
And then
Yeah,
realizing you're out of
Jeff might know. I don't know. All I know is that I'm always getting boxes from you guys, and I'm always going, why are we out of enzymes? Where's the C-zyme? How did we go through that much already? How
and
much?
now you need to try
the
lumberzyme.
D3
You've not
Okay.
tested lumberzyme yet. You need to try
Then
that.
we're gonna start really getting into understanding the niche for the lumberzyme as far as that goes, and it'll take me a month or 2 to figure it out. What I'd like to do for you guys is be a resource for questions that your clinicians have, or for your doctors that are either on board or that you're bringing on board, as to how and why we utilize the different enzyme products and the different probiotic products in a more integrative way. Okay, because a large part of my process of my practice is homotoxicology and doing antitoxic therapy and doing herbal drainage remedy, German drainage remedy therapies. We do a lot of pain management and wound healing, and we're going to be doing a lot more of that going forward. And so when I'm been using the product line, I've been looking toward generating removal of metabolic waste and scar tissue and broken down tissue that are pro-inflammatory, as well as enhancing uptake of di and tripeptides, free amino acids for wound healing. And so and my focus going forward in 2022 is going to be really doing a lot more work with people that have chronic pain and are in recovery from surgery, amputations, burns, etc. There's a lot of value to enzymatic therapy at the highest level, as you are providing to these types of cases. The Therazyme, the C-zyme, the Cerezyme, we pick and choose them based upon the need and the individual's tolerance. And kind of going forward, it's my goal to try and get certain protocols down for pre and post surgical enzymatic utilization. And we're seeing the value of systemic enzymes. I do actually exceed that of digestive enzymes. Okay, I like the restoration of the microbiome. Start with the enzymes to help the person digest and absorb things better, but I come in very early with True Fiber and the Sun Fiber and so forth, to start laying down a biological terrain. We use a mineral supplement that we've designed that has fulvic acid, humic acid minerals in it to help with the pH of the terrain. And then we pick out the microorganisms or the probiotics that are best tolerated and best needed for that individual. One thing that I've noted, and I don't know what anybody else's experience have been, is that I've had incredible results since using this product line with my colitis and IBS patients. And almost to a person, what kind of shocked me is that almost every single one of them needs HCl zyme. Has anybody else seen that in their practice or in their clinical experiences? Because these folks are definitely not digesting their upper digestive pH is off, their stomach acid is off, and I look at it as seeing partially digested or undigested bandwidths of food that people put in, going downstream, going through the small intestine, not being absorbed, not being digested properly. They wind up in the colon, and then they begin to feed whatever bandwidth of microorganisms feeds on what's not digested properly. So if it's proteins that are being poorly digested, then the microbiome in the colon expands to digest proteins. If it's fats and fatty acids, then that bandwidth of microbes and yeasts and so forth expands. And if it's carbohydrates and sugars and so forth and celluloses, then that bandwidth expands in the colon. And so, I look at it as, okay, what's happening in the upper digestive system? What's not being processed? Why do they want something in the colon? A certain bandwidth of microbes, whether it's True Bifidopro or True Flora or whatever. And how do we change it? And all the tools are right there to do that. I find in general, postmenopausal women have a lot of challenges with fat digestion because of gallbladder insufficiency. And so we wind up using first, yeah, I see some heads bobbing over there. Okay, this is some agreement. Okay, so while I may start out with Digestizyme Plus, I'm going to be looking at switching that out to HCl zyme intermittently and moving on to Enzalase. Okay, for whatever reason, women not only enjoy it, they tolerate Enzalase much better and want it more frequently than men. And so, the pathways of women's gastrointestinal health and men's gastrointestinal health are two totally different decision trees, okay?
Would you say the same with
ladies'
True Bifidopro?
attention with that, okay? We've got to look at this as, what is the strength of the individual and where is the weakness? And we're not all created equal, okay? Men's digestive system is much different than female digestive system, especially when you start to get postmenopausal women. And I always ask about how frequent. Think, are your bowels regular? Oh yeah, I go once a week, every 4 days, something like that. And I'm like, no, you're not a trash compactor. You're a human being. You're supposed to put things in. You should have a transit time that's a little bit shorter than 3 or 4 days. Okay?
We should do the beat test at the clinic.
Yeah, so the truth fiber and the sun fiber are just in micro doses are incredible. And believe it or not, I use it in pediatrics. I use the sun fiber in pediatrics and little kids, and I'll give them a little truth like babies even. I mean, just put a little bit in their formula and you get their bowel functioning right, you get their microbiome developing, we'll put a little bit of true flora in with milk or cereal or so forth and so on. And I'll tell you what, kids with all types of allergies, all types of respiratory dysfunction, it's all the GI tract, folks. You all know it, okay? The majority of you know all this stuff. But I use the product line across the entire spectrum from babies to 100-year-old people, okay? I was like literally serious geriatrics. Roland's been in my clinic. He's seen, we've had 4 octogenarians in at the same, on the same day, like mid-octogenarians, okay? And so they need some digestive help. And what I find in geriatrics is that they didn't get old by accident, okay? You see a lot of, fat people, don't you? You see a lot of old people, but you don't see a lot of old fat people, okay? So we really work on, and what you do see is skinny little old church ladies that eat like they're going to the electric chair the next day, and they can digest like they're like goats. They can digest cans, all right? They have super strong digestive system. So in geriatrics, I ask them what they're eating. What do they prefer to eat? They usually have a regular habit of eating, okay? My uncle was 87 years old. He had like, I don't know, grape nuts and a half a grapefruit every day of his life. I don't know, I think the half a grapefruit was the winner, but he was getting some fiber and some, citrus and every day. That was his breakfast was, he had to have his grapefruit, okay? And they have habits, and whatever habits they have, their digestion has in older people, their microbiome has evolved so that they digest, absorb, and utilize what they eat. I don't change it very much. I support it, okay? So if they're a carboholic and they're eating a lot of carbs, well, let's just use a little glutathione here, granny, and maybe a little probiotic and some true fiber, and off you go, okay? I don't go, oh, you got to change your diet and your lifestyle, okay? We know from even rat studies that it takes about 30 days to change the microbiome to do animal studies and digestion studies, okay? So if they feed them strictly a meat chew, they'll develop a certain microbiome. If they feed them just grains, it'll get a certain microbiome for whatever they're testing. So when it comes to geriatrics, don't change much. Just support whatever they're eating, support whatever they're doing. They got to live old because they have not had a failure to adapt, okay? The ultimate failure to adapt is death, okay? And so, geriatrics evolve because they adapt to their lifestyle. One real quick case in point, I had a gentleman, hadn't been to a doctor since he got out of the Army in World War II. He was like 84 years old. Smoked 2 cigars a day. Two cigars, he smoked a cigar. He's like George Burns, okay? Every day at 5 o'clock, he had 3 fingers of scotch, okay? That's like this. Daughter finally talks him into going to the doctor, and the doctor says, oh, you got to quit smoking cigars. You can't have scotch. You can't eat a steak twice a week. You have to have this and do this. And the poor man listens to the doctor. He just gets sick. His daughter brings him to me. He's like, something's wrong with Dad, his nutrition. I said, what did you do? And he told me what he did. I said, well, have a cigar. And tonight at 5 o'clock, have your scotch. I thought his daughter would fall out of the chair. Like, what are you doing? It's going to kill him. I said, he's 84 years old. What are you going to do? Take away his cigars, his 2 cigars a day, and his evening cocktail that he's had for the last 40 years. I said, keep him out of the hospital, away from the doctor. He'll do fine. And we told him, we gave him a little bit of nutritional support and got him back on track. And he enjoyed his cigars and his scotch for another 4 or 5 years. Actually, he lived to be just about 90, and he was happy. And so that's my take on geriatrics. Don't change much. What got them there, just support what got them there. Okay, and with the kids, get their microbiome right and get their elimination right, and they'll do really well. It's the great unwashed in between that we have to be concerned with, and I just find that the vast majority of people need and want a foundation of good enzymatic activity, and good microbial activity is the foundation to health. And it bears out by our heart rate variability assessment, by our body composition analysis, and so forth. So that's my take today.
Thanks, Doc.
Yes. Yeah, go ahead. Thank you. Questions?
Any other anecdotal things that you can provide? Because I know some of our leadership doesn't love when we try to come up with protocols, but when you provide anecdotal experience, then we can relay that to other accounts.
Well, what we're probably going to do going forward, Roland and I have talked about just doing some Q&A about different cases that we have, and doing like you used to be able to do what they call an M&M conference, morbidity and mortality, okay, where you could talk about what worked and what didn't work. See some other smiles there, they've done away with that about 10 years ago. So they're like, oh, that violates HIPAA and you shouldn't talk about other people's cases and this and that. So, doctors used to get smart by doing that because they wouldn't make the same mistakes they made on some other case, all right? They would, an M&M conference was held almost weekly in almost every hospital until about 10, 12, 15 years ago. And now, since they don't have them, everybody just does their own thing and they keep making the same mistakes over and over and over again. Okay. Mm-hmm. So yes, we'll probably pick out some cases like the IBS Crohn's cases. There's some weird things about those. There's some tips to that. Did you ever notice that IBS and Crohn's especially, that they crave cheese, especially hard cheeses, okay? And so they're looking for yeah, I see some more heads bobbing. They look for fermented, they don't like soft cheeses. They want, they want like Locatelli, Romano or Saggio or something like that, hard Parmesan or something. And they almost crave it, sharp cheddar, real sharp cheddar. They say, do you like cheddar cheese? Yeah. Oh, okay. So there's a bandwidth for that. And that's where the microbiome comes in, because what they're doing is they're feeding their microbiome what it wants to digest and ferment what they don't digest and what they don't process. So I think in general, looking at the concept of what are my signs and symptoms, and what aren't I digesting and absorbing in the upper part of my digestive system that's going downstream undigested and unprocessed and not being absorbed in the small intestine and winding up going into the colon as a smorgasbord for microbes. Okay, it's the process of thought process that we're trying to get into. And I usually start with enzymes, but move by the second or third month to using the fibers and using the probiotics, and then alternating. Okay, like I have people doing Theralac Pro one night and Trubifido Pro the next night. Okay, and I'll do that for 5 days and take the weekend off, and they'll do fiber every other day, or I'll do low doses of fiber. Okay, I'll have them do true fiber and sun fiber together, but on alternate days. Okay, has anybody done that? Has anybody suggested that to your clients? No, I mean, right there's a really good tip to get
Yeah.
diversity and toleration of the products. Okay, so you're much better off doing 4 products infrequently and every other day or something like that than you are hoping that you pick the right one and hitting them hard with one thing. Okay, now I got Jeff to shake his head, and that's what I was looking for. Okay, so you follow what I'm saying? Okay, there's a lot of logic involved with this, and there's we can teach the doctors these patterns and these kind of clinical pearls that it not only diversifies your sales, it leads to greater success and patient compliance and better outcomes. We're looking for good outcomes. You have products there that create great outcomes, like fantastic outcomes. I would not forsake your product line or product line for anything now. And when I told Larry, this stuff's rocking my world, after he knows me for 30 plus years, and he knows the work that I've done, and I do really good work in biological medicine and German homotoxicology and so forth. But, thank you, Jeffrey, for filling in a huge hole in my practice with an integrated group of products that work well in every instance. So I'm going to go prescribe some more of these to the overly abundant full waiting room of people that I have. I hope to get invited back and maybe just do a straight up Q&A. And I'm going to welcome that you write down any questions you have anytime and run them through Roland or run them to Larry. And I will be glad to answer them individually or to the group in the group blog or in a Loom or one of those things where I just blah, 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 give you the answer and so forth.
Sorry, when you're testing people and they test well for a proteolytic enzyme, are there any cases where they actually have trouble taking them, or it's just
not usually?
Okay.
No. Sometimes I generally start people slow with them. I'm like, let's do this every other day or only with your largest meal, 1 a day. I don't do 2, 3 a day to start. So I'll just go in slow. Same with the HCl enzyme. But I'll tell you what, that is the most unbelievably well tolerated
the
product.
HCl enzyme?
Yeah, it's amazing. It really is an amazing product. Of everything in the entire line, that one amazes me the most. And
That's cool.
A lot of women really need and tolerate it well, but they need it. Yeah. So,
Great.
Jeffrey, I didn't know if I could or couldn't talk about that, Jeffrey, but he held up a bottle of our Accelerate, which is our magnesium potassium aspartate. We do that product in a product called Mimitab, which is a 1-to-1 calcium magnesium aspartate with the fulvic acid. The Accelerate is really exceptional for energy and endurance, and we can make the claim for that. And so it goes well with a lot of the enzymatic products, because the #1 deficiency in America is magnesium or magnesium potassium, not calcium. The D3 enzyme I'm doing right now, I'm taking 2 twice a day because 1 twice a day wasn't cutting it for me. Fantastic. I think that is just one of the only 2 types of D3 that moves the levels on the blood work. Okay. And in acute cases right now, I'm doing 10,000 twice a day for 5 to 7 days. Okay. Because even a medical dose is normally, they'll give you a single 70,000 IU dose a week, okay? And so doubling that dose for 5 to 7 days is not unheard of, okay? You're not gonna go, take somebody from 30, 40 to 150 in their blood levels of vitamin D with a double, doing 20,000 IUs of D3 zyme in an acute situation. So that is one that I'll dose heavy and then back down, where everything else I dose light and build up to as they get more tolerant, as the microbiome changes. Because really what happens, the intolerance to the digestive enzymes is, it really pisses the microbes off that we're downstream, that we're getting fed huge amounts of food. And then you're like, yeah, the pantry's empty for you guys because we digested and absorbed it all in the upper digestive system and the small intestine. And so they get in an uproar and they don't like getting kicked out of their house anymore. Like when you use the Cleanzyme, okay, go easy, do one every other day, see what happens, okay? And start breaking down that biofilm slowly, okay? Because it doesn't like getting, intense change. Well, it may be good for the person in the long run. They'll stop the therapy if they have any kind of discomfort. So anyway, I'm going to go take care of my crew.
Thank you, Dr. Jeff. Appreciate it very much.
Thank you, guys.
Derek for us.
I'll be back again, and I appreciate it. And it was a pleasure being on, and I look forward to talking to all of you individually. And if you have any questions or comments or anything, let Jeff know, let Roland know. And it's great to see you all.
Bye-bye.